Hey, hello everyone, and welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Two Talk, I have Dr. Rashmi. To give you a brief introduction about Dr. Rashmi did her Bachelor's of Dental Surgery from M.R. Ambedkar Dental College and Hospital, Bangalore. She has done her post-graduation at periodontology from the Oxford Dental College and Hospital, Bangalore in the year 2007. She has a Master in Hospital Administration and from the Institute of Business Management and Research, Bangalore. Currently, she's associated with the Krishnadevaraya College of Dental Sciences, Bangalore, and she is the guide for undergraduates and postgraduate students with more than 11 years of experience in the field of teaching. She has several publications in both national and international journals to her credit. She has several presentations in conferences and has won prizes for her presentations. She is a consultant periodontist and has done extensive work in guided regeneration procedures and performed several implant and laser related surgeries. She is also a certified yoga instructor and takes classes in yoga for those interested to pursue yoga. Dr. Rashmi, that was so nice. Thank you so much for joining me in today's Two Talk conversation, and a warm welcome to you.
The pleasure is all mine, Rekha, for calling me again, and thank you for hiking me up so much. And happy International Yoga Day, belated to everybody. Yesterday was the International Yoga Day. I think we are
So
becoming. The number of people doing yoga has increased in all over the world. Actually,
good, good. So since yesterday was the International Yoga Day, so did you specifically perform yoga for the event, or did you organize any yoga event yesterday?
Yes, our public health department, gave me the opportunity to do a yoga event.
Session.
We
Okay.
did a 1 hour session, which was live on Zoom also, and
Okay.
we did namaskars and pranayama. Now pranayama is more important. No, breathing is the in thing. You concentrate
Yes.
on it.
Yes.
Yeah, so I think we did that. It was quite a pleasant affair. Enjoyed it. I think hopefully even the audience enjoyed it also.
Yes,
So
they would
that's
have. They would have. They would have. I'm sure they would have. So like you said, how pranayama is very important today's date, especially after the COVID pandemic has been there across everywhere, and everybody realizing the importance of general health, and pranayama so related to the lungs
yes.
again, which is the
Yeah.
main organ that has been affected in today's times. So, would you say that you would now advise every patient to practice yoga and do pranayama?
Yeah, I would definitely tell the interested patient to do it because you can't push people into yoga. Because I had this concept that yoga is for very old people. Let me not look at it also. No, sorry, I don't say that I'm old. I'm 18 till I die.
That's
No, but basically, see, there's been a lot of improvement since the last 7 years I've been in yoga. So for me, I think it's a part of life. I think
yes,
it can be a gymming for somebody, it can be walking for somebody. But right now, since respiratory problems are the predominant feature of COVID
yes,
19, I would
yes,
definitely say that you do pranayama every day. Our Prime Minister, Mr. Narendra Modi, also gave a specific this thing on yoga. So I won't get into that, but I say it is definitely good. You won't lose
okay,
anything. Do it. That's all. Okay.
okay,
So that's
okay.
about yoga.
Dr. Rashmi, since you are associated with a hospital, a teaching hospital, dental hospital, have you resumed work there, or were emergency treatment always there in college even during the COVID times?
No, no. Our college strictly followed the government directives, and they closed it down when the government, declared a lockdown. That is from 24th of March, if I'm not
Yes,
mistaken.
yes,
And of course, our college has been very nice, and they've resumed duties in stages. We have gone on rosters for twice a week, thrice a week, and now we have finally resumed it all days a week. And
hmm.
not yet, we have not called all the undergraduate students, that is people who are doing BDS. Only
BDS.
postgraduates have been called back because they are having their exams coming up next month.
Okay,
So theory
okay,
at least is definite, because I think our SSLC exams and all are going on. So even our postgraduates will be writing their
yes,
exams. So few of them are back. It
okay.
is not a complete picture. Partially, I think we are restored in the college, and we are managing to go most days. We are there at least. We are gradually trying to establish a near normal situation in the college as of
Yes,
now.
yes. Considering social distancing is the key right now. I mean,
Yes,
there is no official lockdown as such. You know, government has declared there won't be any official lockdowns as such. So the responsibility of containing this virus lies with each individual. That means
yes,
everybody understands the importance of social distancing and wearing masks so that there is no cross contamination happening. You know, the infection passing on from one person to the other. And considering in a setup like a college, like a dental college, Dr. Rashmi, where, like you said, BDS students are still not coming in yet. You have only called in the postgraduates, and only the
yes.
staff are there. How do you think the colleges have taken steps to manage patient inflow? Because patient inflow is something that you cannot control, isn't
Yes,
it?
exactly. Ah.
So what measures are have the college managements taken up to see and check patients? What protocols have been set up there?
No, definitely. We have done so many meetings in the college regarding protocols. I've been to one of them. So I think everybody has put in a lot of their thinking into this, and then come up with some certain guidelines. Basically, we have made a cubicle at the entrance, and we have made the patient maintain the social distancing norm of about 1 to 2 feet between each other. And mask is a compulsory thing. We have installed a foot controlled this thing, hand
Hand
sanitizer
sanitizer.
right at the entrance. Our students will be fully protected. They are wearing all the protective gear like the PPE, and they're wearing the
Safety.
face shields and N95 masks, and they're using a thermal this thing. What do you call that? Thermometer. The laser thermometer we are using at a distance. So they're recording temperature. Any temperature higher than 99 degree, we are not allowing the patients inside. It could be any number of reasons, but why take chances? And
Yes.
we're also we have our college PNS department has designed a very detailed this thing form to be filled
Safety
or
stick.
answered by the patient. Many of our undergraduates, undergraduates are not there, interns, and few of our postgraduates have been posted there. They make sure they take a detailed history, where you have traveled, do you have other symptoms like
Yes.
cough, cold, or history of cough, cold, and from
Yes.
which area or zone are you coming
Yes.
from, whether it's the green zone, it's the orange zone, or whatever. So based on that, a detailed history is designed so that we can eliminate any such thing that points towards COVID positive patients. So I think from our side we have taken measures, and not only that, at every individual area, I think every 1 to 2 hours we have our attenders doing a regular cleanup of all the
Clean up.
surfaces that are exposed. They're using sodium hypochloride solution spray all over the surfaces, because that is the most effective thing. It is said
Yes.
that 1% sodium hypochlorite can clean the surfaces, and
Clean.
it is
Yes.
against COVID. So all the
Yes.
surfaces are clean. Not only that, I think we are doing just what do you say? The basic treatment procedures have been carried out. It is stopped right from the scare has started. We're doing only emergency procedures.
Yes.
Now, if you have to ask which are the emergency procedures, I would say that mainly endodontic problems come under the and
And
surgical problem, that is oral
yes.
surgery. That is,
Yes.
if a patient has a highly decayed tooth which is causing pain, or a grossly decayed tooth which has caused swelling in the cheek,
Yes.
cellulitis or Ludwig's angina in rarer cases. Okay,
Yes.
patients who require emergency extractions which have painful intraoral swellings also, those only after prescribing the required antibiotics, patients have been
Yes.
called back to do that. Okay, those extractions and all that. And endodontically, I think we are just doing the basic opening. Okay, that too
Yes.
using a micromotor, because we
Hmm.
cannot use an aerotol, because
Yes.
aerosols is one new thing altogether. So I'm sure you would want to know. See, if I have to talk about this, I have to talk about aerosols. Now, what is this aerosols and splatters? I think for a general patient, when any waterborne, see, patient will think scaling or cleaning, they call, right? Although it
Yes.
looks very harmless, I think that's the most harmful procedure right now in
As
these
of
times.
now. Yes.
As of now, it is the most harmful procedure, sorry. So when it releases those things in the air, they remain in the air for a very long period of time. There are two kinds of particle, but our problem is this COVID virus is extremely small size. So
Yes.
it is even smaller than the normal aerosol or splatter. Aerosol, okay, let's not get into the detail.
Details.
This
Yes.
splatter will release the droplet nuclei, which is smallest size. The big
Yes.
problem is it can enter the respiratory passages, the deepest passages, and then cause this pneumonia-like condition that you see
Yes.
commonly here, right? So
Yes.
this is a big problem. So, like, as a protective measure, I think half an hour's gap is given between each
Yes.
patient at least, and
Yes.
each all the surfaces are cleaned between
Yes.
each of the patients to
Yes.
ascertain that there is no aerosol contamination in the
Yes.
operatory. Anything
Yes.
specific you would like to ask Dr. Rekha regarding the
No, other
treatment?
than no, very specifically, if patients would like to know what is available in the college, like is an X-ray being done in case for an emergency, like you said, sometimes we may need to do an X-ray. A checkup
Yes.
X-ray becomes mandatory. So are X-rays permitted?
Hmm. We would prefer to do OPG, orthopantomograph, because there is very low
Full.
exposure over there, rather than do a IOPA wherein hand has to be put into the patient's mouth.
No.
Both are being at a risk for this. We try as far as possible to do a OPG. OPG is the thing that is being done. If I have to talk about treatment, extractions are done, access
Yes.
openings are done. These are all the things. Any abscess, patient says that pus is coming out of my mouth and all, that is going to be drained out. Any
Yes.
procedure basically not using high powered machines which release waterborne particles into the air, we try to avoid that.
Avoid that.
Not
Avoid
only that, I think like the air circulation has to be monitored, more of
monitor. Yes.
open windows,
Fresh
open air.
air.
Yeah,
Yes.
and ideally, of course, we would. I think they are at work to see that exhausts are, fitted
Yes.
behind the
Installed. Yes.
operatory, and table
Yes.
fans are more effective when you're
Yes.
talking of patients being treated for this. These are all the protective measures, of course, and then waste management also is being taken
Yes.
care of, because that is the area of again spread. If not
Correct.
even the even the class force, that is all the attenders and all that, everybody has to mandatorily wear a mask. College is providing that. In fact,
Yes.
I think this Kavach mask, which is a government this thing tested mask, I think you must
Yes.
have heard.
Yes. Yes.
Have you been using it or something? Which is the mask you have been using, Dr. Rika, now?
I use for a if I have to wear normally, I use those Kavach masks. I got them. They're pretty
Uh,
good. It's comfortable to use. In fact, pretty airy
hmm,
and nice. But of course,
hmm,
when I have to check a patient and do that, it is an N95 mask I use with a face shield and things like that.
hmm,
So because N95 mask as dentists, it is very difficult to wear all the time.
hmm.
Because again, breathing through the mask is a bit
Carbon
uh,
monoxide poisoning can happen, no? That's what carbon dioxide content in the blood can increase so drastically, right? So we have
yes.
to keep taking, even these protective
Yes.
measures may not be protective for you as such.
No, no, it should not become a burden even to us. That breathing becomes difficult after a particular point.
Yes.
So
Yes.
depending on how the situation is, what the requirement is, we take
Hmm.
the required precautions for those times like that.
Hmm.
So
No,
again, even if
we got a case in our college, a patient who has to undergo radiation therapy, and that patient does require a scaling. Now, you can't deny a patient who is on a life and death situation a scaling. So,
maybe hand
obviously,
scaling,
for hand scalers rather than
hand
using
scaling,
an ultrasonic scaler. So, like
hand
that,
scaling.
I think from our side, what all we can think of, we are taking. But
Yes,
there is a responsibility of the patient which they have to understand. That
yes,
is, come only for emergency treatment. Don't come for any aesthetic procedures like bleaching and all of that. This is not the time for that.
it's not like
Stay
that.
away, because we don't
Yes,
want to be in the infection centers for you. That is
yes,
one thing. These painful teeth, okay, due to caries or whatever it is. In fact, these days you have these electrical micromotors are being used which
Yes.
generate less of aerosol.
Yes.
Of course, in a private practice, I think it is used more commonly. In a college setup, it would be difficult. We would rather use a normal micromotor. That's how to do a opening.
Also,
That
also the cost factor matters, in trying to bring in all the other kind of equipments to
yes,
reinvest and do it is a
uh,
huge investment, either if it is the private practice or a college setup for anybody. you know
mm,
uh,
mm.
we it's not it is not such a practically possible thing, that
Yeah.
those electric handpieces are pretty expensive.
Yeah, it's 1 lakh. I'm telling you, it's 1 lakh minimum price. Everybody can't
Yes,
afford. I'm giving one
yes,
example. You have to
yes,
invest in a HEPA
yes,
filter, which is thousands of rupees.
yes,
It's more and more of investments only. I
yes,
think it is
yes,
all new. But
yes,
patients have to understand that because that's the
yes,
only way your dentist can treat you.
yes,
Other than that,
yes,
they can't treat
yes,
you. And
yes.
see, it's not that we've abandoned you. Any normal pain, you can do teleconsultation and
Correct,
take our opinion and do. That I always
correct,
advise first you off for teleconsultation. If that doesn't work
correct.
out, you really can't bear it and it has
Yes,
to be treated, please then come and
yes,
visit your dentist or a dental college. College will give you certain primary, treatment measures,
yes,
as I told you.
yes,
Don't come for scaling of your teeth or cleaning just for like that. This is not the
yes.
time for that. Okay.
Unless I mean, the way I see it, I think right now routine scaling procedures are not an emergency as such like that. I mean, unless like you said, probably because of a gum infection, the patient has multiple abscesses in the mouth, and even then,
Mm.
probably hand scaling with root planing, those procedures like that, with hand instruments doing would be more practical and feasible at this time.
Yeah, it is more apt. So I think we will stick to only those. Scaling means hand instrument unless it is emergency.
Okay.
You're losing your teeth and all that. Only then I think that should be treated.
Okay.
Don't come for anything a little more less lighter or less serious than that.
Yes.
Because I think there are a lot of other life-threatening issues that you take care of rather than come for frivolous treatment. But definitely, dentists are trying their level best. I
Yes.
can see we
Yes.
can see in our fraternity people are
Yes.
all having continuous discussions as to
Yes.
what protective measures to be taken and all
Yes.
that. But the patient's duty is to give a very truthful history. Many
History.
a times
Yes.
truthful history is not given. Suppose you come from some ridden places like Maharashtra where it is high, they have
Correct.
to give a history. It's your social responsibility to give a
Correct.
proper history.
Correct.
And
Correct.
one patient came, she didn't report about the fever, but later we came to know even her son has fever. So that talks about something a little dangerous. So you give
Yes.
a proper history. I think
Yes.
the next part will be taken. Then we just gave antibiotics and sent, but still you're putting somebody at risk by coming over
Correct.
there. Other
Yes.
people around. That's how it
Yes.
is.
Yes. Yes. So Dr. Rashmi, what about the other areas like orthodontics or clip, which
Uh,
again does not as such involve it is more what you call as it is a routine kind of a procedure that happens, or even making dentures,
hmm.
uh, these kind of things. Do you think special protection is being done in colleges? Have you resumed these kind of procedures in colleges?
Not those serious processes. Suppose a patient is already on treatment and may undergo some relapse or something like that, unless some treatment is done, I think only those will be taken care of. And in denture patients, I would still say, I think when you come to prosthodontia, I think crown cutting is something they will avoid. These
Yes.
things could be taken up, but they're being gradually taken up. Okay, just
Yes.
be understanding with your dental fraternity so that not fraternity, your dental dentist as such, so that they can also sort out things one by one and give you whatever you're asking for. It takes time. Basically,
Yes.
all blood related procedures, of course, we will halt a little bit. But
Hmm.
others, I think they're taken care of most of the time. But what I am saying is serious orthodontic treatment as such, no, wire tightening or whatever it is,
Yes.
those kind of
Minor.
blood splatterless procedures, I
Yes.
think they're going to be done. They're relatively harmless
Harmless.
comparatively. Yeah, they can be taken up, definitely.
So what about in the department of pedodontics? Now, when a child patient has to be taken care of, suppose there's a child who has a decay, and the child has pain, and obviously children, it's difficult for them to bear that pain. It becomes very difficult. So how is it happening in the department of pedo?
Pedo, of course, they take a history and they try to give painkillers over the phone only as far as possible. I mean, rather you prescribe painkillers there. Of course, if and you know how difficult it is handle a child. And less than 10 years, population is again at a high risk. So unless it's absolutely mandatory, then maybe using hand instrumentation, you can do some kind of an opening there or excavation and give a temporary filling and send the patient back. Everything that is being done is just like a temporary treatment or an emergency treatment, nothing permanent as such, because neither can we afford to use those devices and put the patients at risk, especially these patients who are higher risk as it is. Any child less than 10 years is definitely high risk, and it's not an emergency unless it's extremely painful. Even that could be managed with a painkiller or an antibiotic. That's what I would say.
So Dr. Rashmi, considering in the hospital you get more number of patients per day, how do you plan to do the appointment management? I mean, scheduling the patient for an appointment.
No, scheduling, definitely a gap between patients will be definitely tried. A gap of half an hour is safe period. I think I would say that they would stretch that gap to more 1 hour between patients, and the operatory is going to be clean between each patient. So appointments are only given to less number of patients with gaps, okay, with gaps between them, so that there's no kind of crowding either around the operatory or in the waiting area. We would say patient needs treatment, only patient come. Don't get your brother or sister and come. You can manage to come on your own. Please come and reduce the load. As such is what we would say. Number of patients being treated definitely is lesser, as it is in the private practice also. But I think gradually we'll pick up the numbers once we get a clearer picture about what preventive measures are foolproof.
Yes, what is working actually, because since even we have just started, we have just started treating patients, and since nobody knows exactly, the outcome, how it is, because people are still trying to figure out what this is. So what is going to come out of it, even we don't know. Now, just like how the lockdown has opened up and we have to wait and see, how the virus will be contained. I think even in terms of dental practices, we have upped all the protocols, and we have improved all the sterilization protocols and the disinfection protocols and even the protection protocols. So probably maybe in a couple of months time, we will know how exactly this is going and what more additions or deletions have to be done.
Yeah, as of now, each person treated is being given a PPE, face shield, mask, okay, and those disposable hand gloves. In fact, we have to double glove ourselves, and this would easily shoot up the cost by, an easy 500 to 1,000 per patient being either treated or checked, because you have to assume each patient is a positive when you're doing even a check. So, right? So I think that is the load that is on the colleges to procure materials for each and every person who's treating. That is definitely there.
Definitely there. Yes. So I gather even hospital managements are taking a call on this, and even they have to open up and resume the treatments. And like how you said, possibly as and how we do and we proceed, we will get to know how we have to actually go step by step further. Of course, there are some protocols that have already been laid down both by the DCI, and it has been told what needs to be done. But I think
come up with some guidelines. Yeah, both of them, DCI especially, they've come up with guidelines.
Yes. So I think as of now, most of the private practices have installed and they have incorporated these newer guidelines into their practices. And even the colleges are gearing up, considering, colleges are a bigger setup, they have to do it on a much larger scale there. I'm sure, like the way you said, even they're gearing up, in doing those things.
Yes, definitely they are.
So like you said in the beginning itself, since this is a respiratory related infection, I think again doing exercise, maintaining your health, and maintaining social distancing would be still the key to.
Yes, definitely it is the key. That is the key. Maintain social distance. Take absolutely good care of your teeth. Brush twice daily if you have to brush. Eat the right kind of food. Okay, if you have pain and if you can see that it is emergency, only come visit us. Gradually we will resume most of them. Now I would say around 30% of the treatments are being carried out
Carried
on
out.
and off. Okay.
So, Dr. Rashmi, like, if you say that, patients have to come only if there is a very dire emergency, is there some kind of a helpline or something that the college management is planning to set up so that patients can contact, the colleges on these helplines? Is there something like that you're trying to put in place? Or
Yeah, helplines will work, but you've seen that railway helplines like that. I mean, that way, no, I would say it's still in the colleges. You come and do visit at the entrance only. You have those doctors who are helping you out. Other than that,
okay.
there'll be one or two contact numbers that each of those the treatment team will give
Yes.
out those phone numbers. You
Yes.
procure those, and they will definitely help you out telephonically if it can be
Yes.
helped for you.
Yes.
Definitely, I would say that.
Yes. Okay. Okay.
Uh,
I think that would be very helpful, and of course, the college numbers would be available for anybody on the websites, I guess.
yes, yes.
If somebody in the nearby, in the vicinity of the colleges would want to go there, I think they can always contact the college first, and then pay a visit and get the needful treatment done.
Yeah, definitely. But I say always, I mean, high points for the word of mouth, which spread so fast that even before we started, we've had an inpouring of patients. I don't think they required any telephone line. They just landed there as such. In fact, today was the highest OP. Generally,
Okay.
OP is raising gradually. So I
Yes.
think that word of mouth helps. Helpline is
Yes.
definitely there. The college contact number, as you said, it is there
Yes.
at the website. Definitely procure that and try to,
Yes.
find out first before you
Yes.
get back. Okay.
Yes, yes, yes. So that was very informative, Dr. Rashmi. I think I'm sure, like, if patients who want to visit hospitals to get their treatments done, I think telling them what the protocols will be, how it will be done, what are basically the treatment that is being done, what is it that they have to expect if they go to colleges. I think that is very helpful for all our viewers.
Yes, yes, definitely. So, as we told already, any painful tooth extractions that you would require,
Yes,
all of these, or abscesses or pus in your mouth that is really requiring urgent attention,
yes,
or your orthodontic treatment, which is really, overshot its time, you
yes,
just
yes,
require wire tightening or something like
yes.
that. I think you can easily go because these are relatively harmless procedures to you as well as to the
I'm a
dentist.
dentist. Yes,
Yeah.
yes, yes, yes. Oh, so Dr. Rashmi, that was a very useful set of information that you told all our viewers, and I really hope it will help them, to plan their dental treatment procedures accordingly.
Yeah, yeah, hopefully it is of
Yes,
some help.
yes,
Hopefully it is of some help for people just planning to procure treatment in a dental college.
yes,
So,
yes,
thank you.
yes.
Thank you for
Yeah.
having me,
So,
Rekha.
yeah, thank you so much. And I hope I can get you back to do further talks on other aspects of dental health.
Oh, sure, definitely. My pleasure again.
Thank you.
Okay.
Thank
Okay,
you.
Dr. Rekha. Have a good
Yeah.
day.
Thank you.
Okay,
Have a
thank you,
good day.
everyone.
Thank you.
Bye.
Thank you.
Mm. Okay,
Bye.
bye.
So, viewers, that was Dr. Rashmi, who did help us and tell us about the guidelines dental colleges have put up to treat patients. So, if you are one of the patients who wishes to go to a college or has been getting your treatment done in any of the dental colleges, I hope that information is helpful to you all. If you have any doubts or queries, please do leave your comments below in the comments section, and we will get back to you on that. So, to know more information about your oral and dental health, log on to our website www.thedentaire.com. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. So, until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.